35 years, Florida policymakers have used nonprofit agencies such as the Council on Aging of West Florida to provide a wide array of home and community-based services. However, due to proposed legislative changes, this may change in the coming months and years. Here to tell us what this could mean for seniors and how you can learn more at the upcoming Advocacy Summit is John B. Clark, President and CEO of the Council on Aging of West Florida. Mr. Clark, thank you for joining us.
My pleasure. I'm glad to be here.
Well, let's start back at the beginning here. So for 35 years, this nonprofit network has provided services to frail elders.
Right.
Let's start off with some terms here. Please kind of tell everybody what this nonprofit aging network is and then what services really are we talking about?
Well, it kind of began in the mid to late 70s with the federal government initiated the Older Americans Act programs and services for seniors and communities, and those were in-home services like Meals on Wheels, homemakers, so forth. And then in Florida in the late 70s and early 80s initiated their own general revenue programs. And what happened from all these funding sources is a network sprang up around the state of nonprofit organizations controlled by community people, run by community people who were in it for not profit, but for mission and service. And they began providing these services throughout the state of Florida and have been providing them for the past 35 years. So these groups would kind of
like be the equivalent of the Council on Aging in West Florida in another city.
Exactly.
Okay.
And every place you go in Florida, and I like to tell people, except for a few areas, which like in Tampa, Hillsborough County runs their own programs. That's very unusual. Most of these organizations are nonprofit. They might be called something else, but you can find them throughout the entire state of Florida.
Okay. Well, Meals on Wheels obviously is a program that everybody's familiar with. You mentioned Homemaker. What are some of the others that may not be as well known?
Well, case management, adult day care, adult day health care, congregate meals, transportation, personal care. We can help people with bathing and grooming needs. Transportation, just a whole wide array of services that basically help people stay in their own homes.
So basically by getting one or more of these services, a person can prolong or avoid nursing home placements. That's basically what it's about.
That's the purpose of the whole system, right, to help people avoid that.
So how are these services delivered and at what cost?
Well, they're delivered
through the network.
Right, they're delivered by the network for a variety of ways. A lot of people use volunteers in their services and programs. But as an example, in our agency, it costs, well, I would say our agency around the state of Florida, the cost between those programs that are funded by Medicaid and those programs that are funded by state general revenue is approximately $7,400 a year for one person.
So on average, because everybody is different, but on average, that's the amount it costs to keep someone in their home in a healthy manner. Okay.
And of course, obviously, compare that $7,400 for a year to what it would cost the state if they had to go into a nursing home, which would be $58,000.
Wow.
And the majority of people that are served in all these programs, like the state general revenue programs and the Medicaid funded programs, have been determined to need some level of nursing home care. So they are people that have been assessed and determined to need nursing home care, but are getting the care in the home versus a nursing home.
So if the network is successfully able to do this in that $7,000 range versus a $58,000, sounds like a pretty good deal. So, you know, as the old saying goes, if it ain't broke, don't fix it. Why look for another alternative?
Well, the problem is primarily what's driving this whole issue is, of course, Florida's budget. Everybody who knows anything about what's going on in the state knows that Florida is facing a deficit of up to $4 billion. Unfortunately, what is also happening is the Medicaid budget of Florida, which partly funds some of what we do, is growing at a rapid pace. A lot of this growth, people have said, is because of the downturn in the economy. More and more unemployed people, more and more people go on Medicaid, but the Medicaid budget is growing substantially. So what's happening is some of the private for-profit HMOs have come along and have said to the state, well, if you turn all these programs over to us, Medicaid programs, including long-term care type Medicare programs like we provide, you turn those over to us and we will save you $1 to $4 billion within 4 years. Well, you know, in defense of legislators, if I was a legislator, I would look at that and say, that's very appealing. And so that's what they're looking at doing in Florida, which is a huge, significant change. And that's in addition to other potential budget cuts that we're facing throughout the state with services.
I know, just the term HMO, just in general discussions of healthcare and insurance, just kind of sends a chill down people's back. Could someone find out that a network says, well, okay, you need to go in a nursing home, but we've got a really good deal 3 counties over, and that's where you're going?
That in theory could happen. I don't think, it depends on how the law is written. That's a very good observation, because they will have certain providers that these people will have to use, and certain nursing homes and certain assisted living facilities. It depends on how the law is written, and so hopefully to prevent that from happening. But that's a good point.
It is very important that that family. Right. And I'm sure there's a lot of people out there that think they've prepared very well for retirement, and that Medicaid is just something that's not going to impact them. That's not necessarily true, is it? When you're looking at that type of cost for nursing homes.
And I've talked to a lot of people over the 30-plus years I've been at the Council on Aging, who primarily talked about their parents who never thought they'd be in that position. How many people could afford $58,000 to $65,000 a year for nursing home care? Not many. Florida, 58 to 60% of everybody in nursing homes in Florida are on Medicaid, and these are people who have gone through their savings, gone through their everything in life, and they had to go on Medicaid. So it has nothing to do with whether or not you're prepared for retirement. I mean, people just can't afford that kind of thing.
Right, so it's going to affect a lot more people than may think about it. Well, I know, let's talk about the summit. I know there's several summits going on throughout the state, and we're hosting the one here in Pensacola. Who are you partnered with on the state level to help do this?
Well, on the state level, the Florida Council on Aging, the Florida Association of Aging Service Providers have gotten together, and they are holding a series of these advocacy summits around the state, primarily to let people know exactly what's happening, what they could do if they're interested, what the budget implications are for Florida and for senior services. And locally, we're working with the Area Agency on Aging and the AARP to put the program on. So we're really excited about it. We hope we have a good turnout.
Well, it's free, and it should be for people to get good information. Remind everybody when and where.
It's going to be the Tuesday, the 29th of this month, 29th of March, at St. Mark's Methodist Church on North 12th Avenue. I think it's 2203 North 12th Avenue. It's from 10 o'clock to 12. We'll have very light refreshments, coffee, maybe a donut. Everything that's bad for you we'll have. And we're really excited about it. We hope we have a good turnout. We also appreciate St. Mark's Methodist Church for allowing us to use their fellowship hall for free. So we appreciate their support.
This is really important. Before we go, if you just had one last comment for our viewers of why they really need to be up on this.
Well, they need to know what's going on. That's I'm a firm believer in knowing what's going on, reading the paper, watching the news, and making your own decisions. But they need to know what's going on so they can make a decision on what they want to do and not want to do relative to these changes.
Right. It's always good to be informed.
Exactly.
Well, thank you for being here.
All right.